Gallbladder and pancreas are two of the major organs that are present in the abdominal cavity, and that can give rise to the abdominal pain as well. So, what are the different conditions that can arise over there? We can have a patient of biliary colic primarily due to some kind of stones that are present. Cholelithiasis is the condition particularly that he or she might be suffering from. Then gallstones, particularly. So sometimes the biliary colic is not associated with the stones, and it can be a condition which is basically generalizedly arising in the patient due to some kind of an obstruction that is present out there. So you'd have to look out for these features as well. Cholecystitis due to any kind of a back pressure that is present in the portal duct, and that is again, it can be due to the gallstones that are present, and they're giving rise to the cholecystitis, the inflammatory condition arising due to the cholelithiasis. In turn, we can have pancreatitis as well. So any kind of an infection, it can be an acute or even it can be a chronic pancreatitis that the patient is suffering from. Again, we have to focus on the different enzymatic levels in the blood, particularly the serum amylase levels. They tend to rise in case of the pancreatitis particularly.